As a young, as a young citizen of India, armed with technology, knowledge and love for my nation, with a vision of transforming India into a developed nation, I am joining Shobhit University. What about you?
Very good morning to all the participants from India and abroad. Shobhit Institute of Engineering and Technology Meerut, deemed to be university, and its centers of excellence, Center for Informatics Development Solutions and Application, and Center for Industry 4.0 Technology Studies and Application, in association with African Asian Rural Development Organization, ARDO, New Delhi, organize this weekly webinar, international webinar series on open source digital technologies towards self-reliant India, Atmanirbhar Bharat. Today is the 96th edition of the webinar series, 22nd October 2022. This webinar normally happens at 11:30 a.m. and goes up to 1 p.m. Today, our guest speaker is traveling and he will be joining another 15 minutes. So that's why we got delayed by about 25 minutes. On behalf of the Honorable Chancellor, His Excellency, the Secretary General ARDO, Honorable Vice Chancellor, the faculty members of the university, and on my behalf, and as Professor Emeritus and Chairman of Centers of Excellence, Center for Agricultural Informatics and E-Governance Research Studies, Center for Agribusiness and Disaster Management Studies, Center for Informatics Development Solutions and Applications, and Center for Industry 4.0 Technology Studies and Application, and Center for Health Informatics and Computing. Let me welcome our guest speaker of today's webinar, Mr. Sunil Kumar. He is one of the very innovative founder and CEO of a very important startup, INIGIMA Cloud Diagnosis. I wish to inform the participants and the speaker that the university regularly conducts two webinar series, namely National Webinar Series on Doubling Farmers' Income by 2022, Atmanirbhar Bharat in Agriculture, on every Thursday, and International Webinar Series on Open Source Digital Technologies towards Self-Reliant India, Atmanirbhar Bharat, and every Saturday. Under this international webinar series, these two centers of excellence, namely Center for Informatics Development Solutions and Applications and Center for Industry 4.0 Technology Studies and Application, have organized 95 lectures on very important topics which are very relevant for startups, NGOs working in this area, and research scholars. Open technologies to provision simple and economical IT infrastructure. A roadmap for students using free and open source software and reaching goals of Atmanirbhar Bharat. Open source software in industrial IoTs for SMEs. Free and open source software adoption / business models. Open data platform for smart digital government. Technology imperatives, make in India for self-reliance. Edge artificial intelligence, data governance for data relevant self-reliant India. Digital India, transforming governance and society. India's email service, citizen at indiamail.com. I welcome Mr. Sunil Kumar. You can put your company name and so on and so forth in the name, along with your name. India's email service, citizen at indiamail.com in 22 constitutionally recognized languages. Ecosystem architecture for digital transformation. Education system, cyber critical infrastructure, seizing opportunities in open innovation and value creation network in the digital world for self-reliant economy. Seizing opportunities in open innovation and value creation network in the digital world for self-reliant economy. ensuring food safety and compliance through technology. Digital India, urgent need for semiconductor manufacturing in India. Technology investment in agriculture value chain, role of FDIs. Entrepreneurship and skill development, AI design pathways. The rise of platform economy, revisiting value chain governance. Era of automation, industrial robotics, and Industry 4.0 into German perspective of technology transfer, skill gap analysis, and opportunities. Role of artificial intelligence in healthcare, current developments in diagnosis and vaccine research, digital agri-tech and agri-startup perspective, health informatics network value chain, e-health system and beyond. Leveraging emerging technology for ensuring transparent and traceable agri and food value chain, unleash the power of citizen development and for enterprise software development, e-governance models towards sustained quality service to citizen backed up by technology. Indian MSME to adopt Industry 4.0 technology capabilities, urgent need for mentorship and accelerator program. Building public digital platform using microservices and APIs. Health informatics network value chain, early childhood development and learning. Health informatics network value chain, e-health system and beyond. Leveraging emerging technology for ensuring transparent and traceable agri and food supply chains. Health informatics network value chain, clinical AI, interface between machine learning and health informatics. Health informatics network value chain, importance of social medicine and community health in the times of health emergency. Gravity filter, a simple low-cost solution to the drinking water treatment in rural India. Open source GovTech startups empowering growth with automation. Digital transformation in small enterprises and small businesses of India, challenges and opportunities. National Digital Twin Program, need for a robust geospatial infrastructure. Industry 4.0 in MSMEs, benefits of indigenously developed CollabCAD software from National Informatics Center. Mass serialization and anti-counterfeiting solutions to fight illicit trade. Cybersecurity, risk, challenges, and solutions, intelligence approach to reduce cyber risk. New Internet IPv6 server toward Atmanirbhar Connected Bharat. Indian startups, reflections and possible policy interventions needed for scaling up to Gram Panchayat. Blockchain and crypto for digital assets platform, pathways for global trade. Robot as a service, leverage technology to solve enterprise challenges. Space startups connecting to international markets with emerging business models. Enabling technology for future vision. Vivekananda secondary education and skills development mega projects. Its potential impact on rural entrepreneurship and the rural economy in India. Sports Grail, a digital sports media platform and prospects of Indian sports industry sustainability model at global level. Pharma 4.0, Industry 4.0 applications to pharmaceutical manufacturing, path to a digital transformation. Accelerate and scale non-linear growth through partner ecosystems. Technological renaissance and the human capital, a perspective. Health informatics network value chain, medical outreach, challenges versus potential. Beyond COVID-19, revitalizing micro and small enterprises. Project management essentials. Launchpad for future CEOs and startup founders and beyond. Society 5.0, a new society beyond Industry 4.0 and post-COVID-19. Smart village, oblique community, African ICT, oblique IoT lesson. Digital economy, ways and means to protect and empower for self-reliance. Pragmatic ways for Atmanirbhar Bharat, democratization of essential services by using sustainable energy as a catalyst, transforming India through relevant education and vocational training, digital technology in simplifying citizen life, online learning during the pandemic and its future, smart microeconomic zones, pathway for self-reliance at village level, crime prediction support system, knowledge management for development partnership to achieve the Sustainable Development Goals, SDGs, of the United Nations and implementing the Agenda 2030. Millet value chain from IoT to blockchain, a traceability roadmap, aspirational district program in left-wing extremism affected district, a successful model of data-driven governance, digital agriculture supply chain and breeding hub, a geo-economic perspective, market-driven agriculture, need for development of crop-specific strategies at block level, an open agri network to unlock the trillion dollar plus potential of Indian agriculture with smallholder farmers. An open agri network to unlock the trillion dollar plus potential of Indian agriculture with smallholder farmers. Developing rural entrepreneurship to ensure doubling of farmers' income. Leveraging the power of emergence through connecting the dots, agri startups, agripreneurs, and rural innovators. Agronomy plus agricultural artificial intelligence equal to precision farming. Doubling farmers' income, imperatives of plant health informatics network. Developing commercial breadfruit value chain to help farmers reach high value markets. Commodity value chain creations through agri network and agri AI. Farm to plate, a one-stop agri-tech platform to simplify supply chain and e-commerce needs of food and perishable commodities. Health Informatics Network Value Chain, National Animal Disease Reporting System, NADRS 2012 and beyond. AI, artificial intelligence and metaverse, frontiers in workspace, coconut value chain challenges transforming into opportunities, coffee informatics network value chain, facilitating smallholder coffee farmers into business, health informatics network value chain, building of one health ecosystem, role of digital architecture, diversification of fish and fisheries management and its challenges in Bangladesh, data mining on digital agriculture, drone technology ecosystem, empowering smallholder farmers in India, fisheries informatics network value chain, business plan for fisheries cooperatives to attract investors, market making urbanization work for the poor through the new technologies, disruptive technologies in precision agriculture, strategy for total development of local areas, Dodala, with ICT, digital economy, ways and means to protect and empower for self-reliance. This talk was postponed due to the inability of the guest speaker to participate. Sustainability frameworks and standards for agriculture commodities, global experience. We Mill, a social business initiative for rural women. E-governance in digital India, challenges and potential. Application of AI and digitization in agriculture and animal husbandry. Organic and natural farming, certification and way forward. Transformation through technology, pathway for industries to embrace digital, operational, and knowledge transformation for participating in global value chain. Today is the 96th edition of this very important webinar series. We'll have the talk by Mr. Sunil Kumar, founder, CEO, INIGIMA, Cloud Diagnosis, IEEARC Technologies Private Limited, Delhi, India, on a very important topic, Health Informatics Network Value Chain, Digital Health Analytics, leading to digital twine for better health care. Let me repeat, Health Informatics Network Value Chain, Digital Health Analytics, leading to digital twine for better health care. Dear participants, you see the keywords: health informatics, network value chain, digital health, analytics, digital twine, and healthcare. India is said to be a land of villages. Acharya Vinoba Bhave said India is largely an agricultural country, Krishi Pradhan Desh, and a country of villages, having more than 6.25 lakh villages. 50% of the India's workforce comes from agriculture, and agriculture sector contributes about 19% of its GDP. But the climate change is generating both the direct and indirect effects on agriculture productivity, including changing rainfall patterns, severe drought, flooding, and changes in the geographical redistribution of pests and diseases. Farmers of India are facing multidimensional problems: price fluctuation, debt, and lack of infrastructure and weather. Indian farming community comprises of about 14.5 crores operational holdings, of which 85% of the farmers have small and marginal size operational holdings. Farmer needs timely, location-specific, and personalized information for effective control on their production, risk, and then market their produce to the identified market opportunities. Many national level programs, be it Digital India, Make in India, Skill India, Startup India, Stand Up India programs have faced operational difficulties for its impact at the farm level and farmer level, and that too at small and marginal farmers. Today, under Make in India program, drone applications are made possible and feasible for smallholder operational holdings, image making. And, it's being lot of, applications are being developed through drone applications for agriculture. Home Minister, our Honorable Prime Minister, Shri Narendra Modi, at the 7th Governing Council meeting of Niti Aayog, Team India, meeting held on the 7th August 2022 in New Delhi. In his opening address, he stressed, I quote, the need to focus on modernized agriculture, animal husbandry, and food processing to become self-sufficient and global leader in the agriculture. In his closing remarks, he said, I quote, each state should focus on promoting trade, tourism, and technology via every Indian mission around the world. And I also would like to quote, related to this topic today, the recommendations of the Doubling Farmers' Income by 2022 report to 2018. It is popularly known as Dr. Ashok Dalwai Committee report. I was closely associated with this committee and I chaired two subgroups, Volume 11 and Volume 12B. Volume 11 talks about empowering the farmers through extension and knowledge dissemination, and Volume 12B talks about digital technology in agriculture. It suggested 7 mission mode program for achieving digitalized Indian agriculture system, out of which one is very important related to today's topic. And if this is operationalized for about 14.5 crore operational holders who does cultivation, farming, and their families, and if this topic is operationalized for the farming community, that itself is for more than 14.2 crore population at the rural area. Digital health analytics leading to digital twin for better healthcare because of the following reason. Health components include human health, and farming community also get affected by plant health, animal health, soil health, water health, and fish health and environmental health. And this has to facilitate digitalized integrated farm health management system for reduction of farmers' loss. As of now, these are all vertical silos. And this is, if this is mapped over a village using GIS technology, adopting big data analytics and remote sensing and image analysis, drone applications. This will be, and big data analytics and blockchain. This can facilitate a $1 trillion data economy. Maybe by another 5 years, India has to hold a data center with 5,000 data scientists and data engineers to deal only with this data. It's very important, $1 trillion data economy. Atmanirbhar Bharat, it is the vision of our Honorable Prime Minister of India, Sri Narendra Modi, of making India a self-reliant nation, rested on 5 I's: intent, inclusion, investment, infrastructure, and innovation, and based on 5 pillars, namely economy, quantum jump; infrastructure, one that represents modern India; and vibrant demography, sources of energy for self-reliant India; and demand, whereby the strength of our demand and supply chain should be utilized to full capacity. Digital India program. Mr. Sunil Kumar, can you put your camera on? Digital India program. The Digital India program aims to transform India into a knowledge-based economy and a digitally empowered society. Digital India initiative has been the major driving force for the budding entrepreneurs and a key contributor for the phenomenal growth of the Indian IT sector. To empower the society and build the knowledge economy, the need for digital transformation was felt. I was closely associated with the digital transformation since 1985 onwards. I was the project director for the first 512 plus districts computerization under the project code District Information System of National Informatics Center. And then in 95, I was instrumental in giving a IT blueprint for IT sector, 15 Informatics Network, through a national conference on informatics for sustainable development. And in 2005, Government of India announced National E-Governance Program, NEGP. And in 2014, National E-Governance Plan 2.0, that is E-Granti. And then 2015, Digital India program was announced with 9 pillars, namely broadband highways, universal access to mobile connectivity, public internet access program, e-governance, reforming government through technology. E-governance means reforming government through technology. And e-Granti is electronic delivery of services. Previous e-governance program has been divided into 2 components: e-governance and e-Granti. Information for all and electronic manufacturing and IT for jobs and early harvest programs. And according to NASCOM, India's IT sector is set to become an $225 billion industry in financial year 2022, registering a 15.5% growth, which is the highest in over a decade. On 20th February 2019, the Ministry of Electronics and Information Technology published a report titled India's $1 trillion Digital Economy Opportunity. In association with the McKinsey and Company, it identified about 30 digital themes, if scaled up nationally, can accelerate India's progress in 9 key areas. Digital world, the rise of platform economy. We need digital ecosystems, which are essential for digital transformation in the digital world. Emerging technologies making impact are AI, 5G, IoT, serverless computing, biometrics, augmented reality, virtual reality, blockchain, robotics, natural language processing, quantum computing. In India, we have 3 ecosystems. Industry 4.0 for digitalizing 63 million small-scale enterprises, MSMEs. And Society 5, this has come from German. Society 5.0 comes from Japan. And India has to contribute agriculture 4.0. India has established, evolved an Amrit call led up to 100. That is by 2047, how new India will be. And how to achieve that, they also have an IT blueprint. And on Independence Day speech of our Honorable Prime Minister on 15th August 2022, that is 76th Independence Day, he has given to the whole nation 5 pledges, namely Panch Prans of Amrit Kal, goal of developed India to be achieved, remove any traces of colonial mindset, take pride in our roots, unity, sense of duty among the nation, citizens. We have sustainable development goals of UN and Agenda 2030, 17 SDGs and 169 targets to be achieved. Today's topic is Health Informatics Network Value Chain, Digital Health Analytics leading to digital twin for better health care. The Doubling Farmers' Income by 2022 Committee Report 2018, in its Chapter 10, recommended digital technology in agriculture, 7 mission mode projects, which include digitalized farm health management for reduction of farmers' loss, which includes components such as farmers' health, plant health, animal health, soil health, fish health, water health, and environmental health. This university, Shobhit Institute of Engineering and Technology, has established a Center of Excellence, Center for Health Informatics and Computing, to propagate Health Informatics Network Value Chain. And we also have an intent to offer MSc Health Informatics course and BSc Health Informatics course to teach biology students artificial intelligence, big data analytics, and blockchain technology and image analysis to strengthen Health Informatics Network program in the 6 components which we talked about it: human health, plant health, animal health, soil health, fish health, water health, and environmental health. Under this webinar series, university has organized 9 webinars related to this topic: Health Informatics Network Value Chain, e-health system and beyond. Health Informatics Network Value Chain, early childhood development and learning. Health Informatics Network Value Chain, a healthcare startup perspective, which was postponed because of the speaker had COVID-19 issue. Health Informatics Network Value Chain, clinical AI, interface between machine learning and health informatics. India has got about something like 50,000 primary health center and about 42,000 animal husbandry primary health center. We need to have a clinical AI. The digital health analytics will facilitate with the digital twin in 50,000 primary health center and 42,000 animal husbandry primary health center in the country. Health Informatics Network Value Chain, importance of social medicine and community health in the times of health emergency. Health Informatics Network Value Chain, medical outreach in tribal areas, in forest, interior forest, challenges and potential. Doubling farmers' income, imperatives of plant health informatics network. Health Informatics Network Value Chain, National Animal Disease Reporting System, NADRS 2012, I was instrumental in operationalizing, and beyond. Health Informatics Network Value Chain, building of one health ecosystem, role of digital architecture. Digital Twine Program, National Digital Twine Program, need for a robust geospatial infrastructure. Apart from digital infrastructure, you have to have a robust geospatial infrastructure, especially in smart city areas. India is a hotspot of several neglected zoonoses, such as zoonotic tuberculosis, Q fever, trichinosis, brucellosis, besides various foodborne diseases. One Health eco-health approach calls for synchronized and synergistic efforts for disease control, and health risk management on the part of relevant sectors including digital health, agriculture, departments of health, agriculture, animal husbandry, fisheries, environment, forest, among others. They have to be integrated. Department of Health, Department of Agriculture, Department of Animal Husbandry, Department of Fisheries, Department of Environment, and the Department of Forest. One Health oblique Eco Health aims at strengthening the links between human health, animal health, and management of environment, plant, animal, fishery, soil, and water. Indian healthcare system includes allopathic system of medicines and Indian system of medicines, that is Ayurveda, Siddha, Unani, and homeopathy. I would like to quote Dr. Alexis Carrel, the Nobel laureate, in his book titled Man the Unknown. In 1935, he quotes, minerals in the soil controls the metabolism of cells in plants, animals, and human. Hence, soil has been intrinsically linked with plant health, animal health, and human health. Doubling farmers' income, that's why it recommends digitalized integrated farm health management systems. In linking human health, plant health, animal health, soil health, fish health, and water health, it's very important. And universal health coverage is an important step towards achieving Sustainable Development Goal 3, possibly through a sustainable society or a society 5.0, which is envisioned. India's Prime Minister's Jan Arogya Yojana 2018 has sought to accelerate the universal health coverage. And SDG 3, COVID-19 pandemic has forced the government of India to recognize the importance of One Health and established a National Institute of One Health at Nagpur in 2021. Need for Health Informatics Network Value Chain. Adoption of Smart Village Framework facilitates creation of value chain network for sustainable integration. My paper published in 2019 deals with the advancement in the field of health informatics and also impending need for bridging the development gaps in human resources in health informatics area through academic programs. Different agencies are involved in human health, animal health, and agriculture and food safety. They require shared access to the information available. Epidemiology and the laboratory networks play an important role in gathering quality disease data and providing epidemiological interpretation. Risk factors or drivers of disease emergence take ecological practices and conditions into account, including land use, climate, demographic, and economic data. As part of these approaches to improve linkages of communities at risk from agriculture and associated diseases with the policymakers, public services, and non-governmental organizations and researchers. So health informatics, as established, uses information technology to organize and analyze health records to improve healthcare customer outcomes. Health informatics is a rapidly evolving field and getting influenced by and impacting on many different knowledge domains. And health informatics has emerged as an important informatic discipline of late, encompassing the discipline of artificial intelligence, big data analytics, cloud computing, social networks, mobility, Internet of Medical Things, Web of Medical Things, blockchain technology, biological computing, geomatics, bioinformatics, etc., leading to new medical treatment and new diagnosis. Establishing health informatics network value chain will enable no lockdown process on any account of any pandemic situation in future. As through big data analytics, it will facilitate quarantine only those who may face problem in such situations. E-health system technologies provide economy of scale. Society, it targets societies and also facilitate governance, and it is human centric. And we need to build up digital health platform. Digital health means AI and machine learning based on platforms that aggregate health data, patient data, plant health data, and so on and so forth. A digital healthcare ecosystem is an infrastructure that supports the shift from an organization centric to a patient centric model of delivering healthcare services using digital platform. Digital transformation means building public digital platform using microservices and AIs. Microservices architectures and APIs for development of public digital platform is very important. Integration of digital education platform and digital health platform are very important. India needs health informatics professionals having health data analytics capability, be it human health, plant health, animal health, soil health, water health, fish health, and environmental health, both in MSc level and BSc level, and this will facilitate $1 trillion sustainable economy. And is it not the right time for India to have a national center on for health informatics very effectively? This university has taken an important step of establishing a center of excellence on health informatics and computing. Future is online, database, smart cards, online doctors. The longer a nation waits to embrace the future, whether through private or public systems, the less prepared it will be for the next inevitable pandemic. COVID-19 has given the world a glimpse of the future, and role of digital architecture is very important. One Health and UN has established a UN framework for One Health, aspect, and One Health concept, human health, which deals with food security and food safety, plant nutrition cycling and soil fertility, plant protection, pests and diseases, and environmental health deals with microbiomes, and microbial diversity and multiple functions. India is establishing India Digital Ecosystem Architecture, India 2.0, that enables governments and private sector enterprise to design IT architecture that can span beyond their organizational boundaries, enable delivery of holistic and integrated services to the customer. With the BharatNet establishment and also 6.25 lakh villages inclusive, this India Digital Ecosystem Architecture 2.0 will bring the return on investment. One Digital Health is a proposed unified structure. Conceptual framework of One Digital Health steering wheel is built. One Digital Health steering wheel is built around two keys. The digital health steering wheel is built around two keys. One Health as one key, and digital health is another key. That's why today's topic is very important. Even though this article has been published in 2021, and I thought that I should quote it. These two keys and three perspectives: individual health, well-being, individual health and well-being, population and society, and ecosystem. And 5 dimension: citizens engagement, education, environment, human and veterinary health care, and healthcare industry 4.0, adoption of industry 4.0 technology. One Digital Health aims to digitally transform future health ecosystem, implementing a systemic health and life sciences approach that takes into account broad digital technology perspective on human health, animal health, and management of surrounding environment. Digital twins are a digital representative of physical assets. It's a virtual representation that serves as the real-time digital counterpart as a physical object and process. And today is the first which I myself is going to see the digital twin in the health sector. And as per the market opportunities, the market value as of 2019 is $4 billion. But market value for 2026 is about $35 billion. And machines and equipment health monitoring applications, it will achieve more than 34% growth rate CGR. That is the digital twin market. Emerging technologies are 3D printing, advanced analytics, advanced material, advanced robotics and cognitive automation, artificial intelligence, biotechnology, biomanufacturing, blockchain, cybersecurity, digital design, simulation, integration, energy storage. It's very important, energy storage, and high performance computing, next gen computing, interface of things. In interface of things include augmented reality, virtual reality, mixed reality, wearables, and gesture recognition, and Internet of Things, and internet interaction and collaboration, and digital twins, and digital twins prototype, and digital twins, that's instances, DTI and DTP, and digital twins aggregates, many digital twin prototype, which leads to digital twins instances, which leads into many digital twin aggregates. And this is very important. No digital twin without digital thread. Means you have to have a geospatial digital thread, which is very important. And as far as publications are available, digital twins is still infants, but with greater promise. Transformation and innovation are the two terms often used synonymously, but the same thing but linked. United Nations Industrial Development Organization, UNIDO, strongly advocates adoption of innovation management standards 56,002 2019 for digital transformation and innovation ecosystem to comply with, because this is an innovation, this is a digital health innovation. And my request will be that guest speaker Mr. Sunil Kumar also to adopt digital innovation management standards 56,002 2019 also in his project. With this background, I would like to turn to the address by our guest speaker, Mr. Sunil Kumar, founder and CEO, INIGIMA Cloud Diagnosis and IEEARC Technologies Private Limited, Delhi, on very important topic, Health Informatics Network Value Chain, Digital Health Analytics leading to Digital Twin for Better Health Care. This topic will motivate and galvanize the participants watching our telecast through facebook.com, Shobhit University India, youtube.com, Shobhit University in, or linkedin.com, company Shobhit University, by synergizing missions like Digital India, Make in India, Bharatmala, Saharmala, Skill India, Startup India, and Startup India program at village level. Also to establish 2.25 lakh health tech startups, one per each Gram Panchayat in the country. This will facilitate emerging open tech foundation, technologies, emerging open technologies through transformation through technology, digital transformation, operational transformation, and knowledge transformation, and quantum transformation. As the technology baseline, quantum technology, digital technology, operational technology, and knowledge technology, and has taken up very important verticals: education, health, agriculture, and finance. And this itself will facilitate India to achieve $10 trillion economy by 2030. So today's topic is very important with respect to this aspect. Let us unlock the opportunities in India at the earliest. And let me introduce the speaker to the audience, Mr. Manish. Mr. Sunil Kumar began his career in research, health tech and research startup, having 6 years of healthcare research experience and 7 years of working in startups. Responsible for project design, software architect, algorithm, data analysis, medical research, design thinking, and problem solving approach. Funded and supported by digital Delhi government under Delhi University for funding, incubation, and mentorship through SIIF incubator under Startup India initiative by Government of India. Yearly investment from BIRAC big grant project in diabetics management with Amity University and supported by Microsoft Startup Accelerator Program, Founder Hub. Worked in BIRAC project as an industrial collaborator, and he is also an article also is published in MIT Solve. And he was selected in Upper Elevate and currently supported by NASCA, Microsoft Accelerator, and CSIR, Indian Institute of Toxicology Research. And other acknowledgement include one of the top startups selected by Niti Aayog panel, AICTI selected in top startup in IIM Ahmedabad TIE event, selected by Sigma Group of Institute under Government of Gujarat, and Sayaji Startup Summit, selected in Upper Research Institute Innovation Accelerator Elevate. He is acknowledged as one of the best healthcare company to create an affordable healthcare ecosystem, recognized as one of the top 10 health tech companies. He did his BTech and MTech nanotechnology and also pursuing PhD study on diabetic complications progression and designed biosensors from Amity University. He has 3 publications in the international journal on his PhD research work. He attended 4 international conferences and presented his work. He has been invited as a guest lecturer in many universities and also guest speaker in international symposium and also DD Doordarshan national programs. He featured in MedGate Today and CEO Insights. With this introduction, I would like to request Mr. Sunil Kumar to participate in the international webinar series on open source digital technology for self-reliant India to talk on health informatics network value chain, digital health analytics leading to digital twine for better health care. Thank you. Over to you.
Hi, sir. Very warm good afternoon. I hope it is audible.
Yes.
Hi,
Audible.
sir. Thank you very much for thank you so much for giving this opportunity. And it was very warm introduction for me. Thank you so much for giving this warm introduction for me in my startup career. It was really very kind, and it's my fortune being here and presenting today, being this one of valuable healthcare informatics value chain and digital health analytics leading to the digital twin for better healthcare. This is one of the topic which is right now as one of the emerging sector, not only just India, also in entire world. It is one of the hottest topic after the COVID-19 that we know. Okay, right now we just needed to adopt certain things which can be very helpful in order to understand the healthcare in a much more closer way. And here is the some of the challenges once we have that population, and once we have a lot of challenges out of that, we have, if we are talking about country like India, where is we have 130 crore of the population, where we need to be look after not from the metro, we need to look from the rural India to the metro cities. Every segment we need to take care. During this time, it's very important to understand where we can be having a lot of barriers and challenges. here the technology play a major role. I feel like during my 7 year of this startup journey, I find out that some of the things can not only solve just by doing some research work in the lab. We need to be step out of the lab and do something which can be actually can be executed in the real time market. So this is the something that we need to understand. Now we are talking about that industry 4.0, which is like we are into the fourth generation of this industrialization, where everything is getting automated system, like robotics is there. Now that industry don't want anything which needed to be done manually. Now they just wanted to look from certain things which is very quicker way, a very short span of the time they get result. For example, earlier we used to be take a lot of times to book the ticket once we go to any offline model. Let's suppose I'm talking about we don't have this irctc.com, go IBGO or anything which is facilitate us to book the ticket online for the flight or train. But the moment technology intervene, ki online the person can book the ticket from the home itself. That gives them a benefit. So technology adoption always been making our life very easy and accessible. That is one of my strongest skill that I have learned from during my this 7 years of journey. And I feel like this technology has to reach that beyond the social and economic barrier that we are trying to do, whether it is a form of artificial intelligence, machine learning, healthcare data analytics. So I feel it needed to be just reached to the population where it can be add even more value, not to just to certain corporate, certain institution, those who can get benefited. I feel it needed to be get benefited from the sides of that the population, those who are actually going to be get benefited out of this. So here is the data analytics, this artificial intelligence model for whether it is for diagnosis, whether it is for like identifying the trend and pattern of the health for particular geographical area. And Professor Moni has explained all the particular from the top to bottom and bottom to approach to get what this unified health system means, where we are talking about human health, animal health, plant health. So we are talking about not just here the human health. It is the overall health system, because in this ecosystem we are all connected. We just going to be get connected with. I think that the file upload process is having some issues for my presentation. I think. I think this net connectivity is little close that the presentation is unable to upload, I think. But anyhow, so we are talking about like the health system as a unified model.
Mr. Sunil Kumar, you forward your presentation to Mr. Manish. He will present it, so you can tell him that next. So
That
okay. Or you send it to me. I will I will present from my side. No, you send it through WhatsApp to me.
okay.
Okay.
So, meanwhile, I will follow the presentation. So, this is something that
Ah,
we talked about, and Sir also explained about what exactly that overall health means, because it's going to be help us to understand that overall scenario. Whether if the geography of any area is not good, let's suppose we are talking about some places like Delhi, and if I compare Delhi with certain hill area like Simla and any other places, which is as an environmental aspect, it's directly correlation with the environmental good and that population health. So it means we need to understand that environment directly impact the health system, the same with this plant and this animal health. So we cannot skip any out of the things. That is the one of the like wonderful point that I have added. I did that closer insights from like Professor Moni. Like, we need to be closely watch not just a human health. It is all about that complete health system that we need to be look after, because this ecosystem we are all connected. So we cannot say okay that you are we just needed to be look out of the certain things. Okay, only the human health is important, only this particular thing. So we need to closely work on this thing. So that is why it's become very important for me. and this session was really very meaningful. I hope like it will be going to be like valuable insights I will give it to from my side, my experience, and I will try to add certain knowledge. Closely I work with the some of the diabetic and this lifestyle diseases parameter, so I will closely give my experience also, okay, how exactly I find it out the patient behavior, where that the population are most struggle in terms of their management of the health. And that's one of the skills that I have gained from the COVID-19 situation also, because you've seen that now after the COVID-19 we have learned a very important lesson. This kind of situation is not going to be happen just for one time, and it's going to be there for all the time. We can't see there is no another pandemic in the coming future. Definitely it will be there, not just after 5 years or maybe possibly 10 years, but down the line, maybe possible 20 years, we can see certain challenges. Not just COVID-19. We have seen the COVID-19 virus has been replicated into multiple variants, and after first wave, the second wave become even a more impactful, and it's caused a more like major mortality. If we have certain data and information, we can understand which kind of population is going to be get more risky state, what are the locations where the impact is going to be more high, what are the people those who are going to be chances are getting more critical complications. So that is the something that can be solve the problem much more quicker way, and we can have that all the logistic problem, medicine delivery, or we can say anything like whether it is a delivery of any mechanism to reach to that last milestone can be even much more easier if we have this data analytics approach. The technology adoption in India, it's little slow. Personally, that is one of my experience. So that is something that I feel like institution like Soviet University we coming out with, okay, that we need to initiate something which can be till that, okay, that health informatics we can taught to the certain like the population and students those who are coming out of 12th class, they can go and pursue this kind of courses and they can understand, because this is something going to become a future. You need to know what exactly this data means. So far we have collected the data, but we have not utilized and leverage this data into that information system. That is one of the challenges that we are right now struggling. Every Abha mission is there, National Digital Health Mission is running out of. So right now, that is the first initiative that is taken out of the government. That is one of the wonderful initiative. Now the population can actually understand what is the meaning of this digital data healthcare system, which can be add value to me as a personal. Like let's suppose I'm a patient, if I'm keeping this record, what is that first thing that I need to know? Before that, if you coming out of that hospital, if I'm talking about last 10 years of any patient, if you ask, do you have any diagnosis report or any kind of medical prescription, what the medication that any doctors has been given to you so far for any particular disease, nobody is having this kind of data information. And that's become the one of the problem once they transform into the any secondary complication, like the in a younger stage you don't know, okay, when you will get a diabetic sudden heart attack or any kind of cancer like problem. Now in India we need to see that that majority of the population, like every single second person, if you talk into that in home, they possibly getting impacted with the diabetic BP or any of this hypertension, obesity. Lifestyle is completely changed. We are as the technology we are holding in our hand, we are holding that unhealthy lifestyle also. That is one of the problem that we have seen. And this is, if any problem which is caused by the technology, I feel like it can be going to be solved only with the one of the technology, because we need to deal with a lot of population, we need to deal with the uncertain challenges which is we are facing right now. So I think this is going to be one of the fundamental challenges that's going to be remain after here, and that can be only solved with the this technology. And once we have this data driven approach in our hand, and it can actually going to be solve the problem in a fraction of time. Now you don't need to see the patient, and you don't need to look out that last tenure of the history, what exactly they gone through. This data is completely missing, but this system can allow one patient to see from the doctor perspective, they can see what exactly this individual persons are. India like country, we have a huge demographic, and there is a lot of genetic diversity is there. from northern side to the southern side. There is a lot of environmental factors. Some regions are very cold, some regions are very humid, and the very summer. So there is a lot of variation in the ecosystem itself. So we cannot say this particular approach of the drug can be impactful to this particular set of population. So there is some kind of drug development needed to be coming out of these pharmaceutical companies, which can be very precise to the particular population, and that is where it's going to be add even more value. So that is the one part that I learned, okay, that how this particular data driven model, this AI informatics system, and this overall healthcare informatics system can add a value to this entire ecosystem, not just a human health, because humans are like directly indirectly connected with this ecosystem, so they can get harmful impact out of this, whether it is a pollution, because Delhi nowadays, if you ask any child also, they are getting impacted with the asthmatics or respiratory diseases problem in the very early stage, and that disease is coming once you talk about last 20 years. So it's this kind of problem, basically asthmatic kind of problem, which coming once the like you cross more than 50 years or something like that, but now below the 20 years age, children are getting this kind of diseases. So somewhere this ecosystem is very harmful for them, and we need to understand how much going to be impact them. That is the most challenging part. We know the problem, but we don't know how long it can be there. What is the after effect of these things? Whether this early stages of the respiratory disease can be transformed into the lung cancer. Is it there any possibilities where this early stages of this progression slowly it can transform into the any secondary complication? And if you look back into the 50 years or something like that, because that time I definitely not born, but I know that time if you talk about the cancer kind of disease, it was very rarely anybody have been like listen or heard ki, okay, that somebody get the diabetic, and according to me right now the hypertension also the keyword I never heard during my school time also, ki this is the considered as the one of the potential threat to the population, which can in future they can basically cause that heart attack or anything. So now it's become a one of the challenge, like mental health and physical health and everything, like this small segments are now become very deadly, that we haven't taken that serious into like last 20 years. But right now, if you have not taken that serious approach for this healthcare informatics, the data driven approach right now, so that's become very complication into the future. So slowly, but we need to learn to adopt this technology in our healthcare ecosystem, and we need to see that down the line, definitely it will going to be add a positive role, not just healthcare facilities, because now they can get the patient details information prior to get any kind of critical cases, so they can take a better that patient cases and dealing and managing by these healthcare facilities. If somebody get any kind of critical problem, so they can easily manage all these things. So that is one of the problem they can be solved through this approach. I think sir, you received the presentation. I think you can download that PPT. Sir, you are in mute actually. That is why we are unable to.
Anish, I have forwarded the presentation to your WhatsApp. Please download and then present from your side. Yeah, he is doing it. Okay. So it is
Thank you
very
so much,
nice.
sir.
There is, you speak to the mic. There is some disturbance from your side also, and it is very important that you have, you know, you know, one is that I am thankful that you are under all difficulties you were able to join. That with all the delays by the railway system created today. But the topic
Right.
is very important. You have given. That's why I also gave importance of this one, because I am completely aligned with the health informatics network value chain. It's very important, and we should take advantage and we should bring in. That's why I took more time to make the our own understanding appropriate. And your introductory talk is also very important, and it is very and that's why like that article we cited, that it has got two keys. One is one health key, another one is digital key. And then also talks
Exactly.
about that three imperatives. And the three imperatives is that three imperatives. It talks about and and this is very important thing that it talked about. I was quite impressed by the that it talks about the you know two two keys and three perspective, individual health and so on and so forth. So it is very important. And now I would like to, now the slide is on your and please carry on, please carry on,
Yeah,
and
yeah.
later we'll
Please,
discuss that.
definitely. Thank you so much, sir. So, just sir, can you just go into the next slide? So this is the like I my journey. So you we can skip out like that. Sir already mentioned about all the things. So this is so far our journey. We've been initially begin our journey with the I basically once I was in MTech second year, so I began my journey as a startup. So I just wanted to explore more and more. So I remain here for and I just see. So you can just skip all this slide.
Don't skip anything, because it's all value chain for many people.
Yeah,
Hmm.
yeah, yeah.
You go to
So,
the uh,
next slide, sir, please. We can go to directly to the topic. That is. So from there, like the things that I basically I talk about, ki, what is the possibilities where the patient even not realize even they are going to be get the problem, but any nearby healthcare hospital or district hospital or any doctors nearby, they can know, ki, okay, this patient is having the high probability of getting any kind of major infection, whether it is a heart attack or any kind of a stroke, whether it is anything lifestyle disease problem. So this is the something which can change the entire future of the healthcare. I feel like once any patient even not aware given they are going to be get the problem, but that healthcare information system can take these things and convert this analytics into such a way where the actually healthcare facilities can know, okay, okay, this is the probability can happen. This is called the predictive analytics. And I've been working in this particular model basically for the lifestyle disease, especially for the diabetes. So then I come to know, okay, what is going to be happen once any particular patient, those who are diabetic, they can probably cause into the future any kind of diseases that we can understand right now. Please, sir, next slide. So this is the something which is emergency situation. Suppose somebody is going to get the heart attack. So what exactly is happened as a normal approach? Somebody get the stroke or the heart attack. We call to that ambulance emergency number. So ambulance will come. That will also take certain time. Then after that, whether that ambulance is equipped with any kind of emergency facilities, any doctors are there. So in India, very rarely it is happening. So obviously that is also going to be delay to reach to the hospital. While between these things, we can get particular care for this patient. And while reaching this patient to the hospital, already some of the important point has been already gone. Now the doctor will come and they will attend that case. Okay, what exactly happened to the patient? Now that patient, let's suppose anyone is there. So then they will look into their. They will again run the test to understand whether the person is having the diabetic, hypertension, lipid profile. What is that? For example, if you do this entire process during this critical emergency situation, how much time is already gone during this process to understand this patient background? During this time, which is completely gone losing, because every single second is important during this kind of emergency cases, doctor know this part. I feel like if you have the second approach, you call that ambulance. During that ambulance, you have given certain unique ID for this, where the all the previous historical data is stored. This digital twin is present for this particular patient. If this digital twin which is present and shared to this hospital, now the doctor who is going to attend this case can be having all the access of the previous information, what kind of medication they have used so far, what is the blood sugar level over the period of time, blood pressure, everything is there. every basic data which is very important in order to perform any surgery or any critical treatment. Now the decision making process is going to become very quick. You can save a lot of time, where this every single second means a life that you can add here, and you can go for the treatment, and the doctor can take a better decision out of this thing. So this is the meaning of the data and information, where you can save the life of one person. In I'm just giving you just one simple example, and there is a lot many cases where this approach can be taken and save the millions of life, not just one or two. That is the advantage of this particular technology and platform. One doctors right now sitting to any places can consult the patient remotely anywhere in the India, whether it is in rural India or any places. Imagine the possibilities if we know this kind of data analytics digital twin model has been approached and implemented by healthcare facilities to understand that nearby population. They can know कि when this particular group of patient can having the possibilities of any risk life threatening condition. We don't need to wait for that much of a bypass surgery, kidney failure, dialysis condition, where that life threatening is very, like the probability of saving a person is very high. Not only that, I find it out in the rural population, this apart from the metro cities, the rural population, they don't have such access to the good hospitals. They have a very limited income. They have a very their expenses are very minimum, so they cannot afford to pay this much of 5 to 10 lakh rupees of cardiology, bypass surgeries, dialysis condition, where this we have seen the lot of financial barriers are also there. So this preventive healthcare approach by digital twin can save this particular group of population. Lot of financial support can be given to them, because this primary treatment is always very less expensive compared to the secondary treatment. The government can take this thing approach. Let's suppose any government budget is allocated for certain group of population for doing this particular things, the bypass surgeries or any secondary treatment, where the government can also save a lot of healthcare budget implementing such technology, where they can save the population before they fall into any critical condition. So that is the one approach can be taken, and that can be add a much more value from the government perspective. I feel like rather than we are spending much more money to the secondary treatment, because you consider the 10,000 rupees of medicine versus the lakhs of rupees for the bypass surgeries or anything that can be not going to be performed into some of the rural area or all these things. So in that particular area, we can approach this thing preventive healthcare modeling and digital twin for this particular group of patient, where we can know the risk state of every individual person, and the hospital can have that access of this data and information. So so please next slide. So right now, from the very longer period of time, we have seen that we used to keep that health record into the file format. You go to the any hospital, you will see there is a bundle amount of the files of particular patient data logs are there. But now we have come out certain things. Okay, we can scan, we can convert into PDF image format. Now we have that storage platform, digitalization, electronic health record, EHR system, EMR system, electronic medical files, and all these things we have adopted. Now we can at least coming out from this file level of system, we can reduce that storage, like the loss of data can be also minimized. But we are stuck somewhere, I feel like, that where the user and enterprises are not able to leverage this data and information, where our basically technology is helping for this thing. The user can use this technology to get that predictive analytics, what exactly the outline of the health down the line 5 to 10 years. And this enterprises can know this, drug pharma companies can go for the new drug research, medtech also can understand, insurance can also optimize their platform, okay, where we need to look after to secure this certain group of population. So the market opportunity can be open for all the enterprises as well. So Enigma dataset, basically what we are doing, we are arrangement of the data we are into such a fashion it can be developed into further ML algorithm. So that we need to be have the first of all to develop AI or any ML set. We needed a very concrete and very specific data for that one. A very deep data we need to have. So this unstructured data cannot able to develop any good AI model or ML model, even for the diagnosis or drug development. So we needed to be have such structural data which can be actually going to be developed, and that needed to be continuously also. So visualization of data, so that can make actually to understand okay, that we can understand this data structure. Even the patient can understand this basic data. It's not like okay, that we don't need to make them to see okay, this is just a medical record. They cannot understand. Patient can also need it to be understand what is the risk state. Then interpretation of data, of course. So this is the entire hierarchical system which is consist once the data come into any system or any software AI model, how we needed to believe this. So overall objective is just very simple things. Nutshell, I wanted to say that we need to take that information out of this millions of data. So please sir, next slide. So, why the digital twin in the healthcare? Why we are talking about this particular topic right now? So that is also one of the very important aspect. We need to very much clear. We know that okay, this technology is going to be helpful, but think about as a personal, as a human. Let's suppose I am studying one patient data. Suppose that I am a doctor, so I am just reading the one patient data. So how much data manually I can read and I can recall? That practically impossible. I can recall even the 10 patient data over the period of like I'm treating for 1 year. So this millions of data which is generating by the lot of hospitals, OPD clinic all across this India, how exactly it's possible any particular group of doctor, those who are working in any facility, they can remember all these data points? Nobody can remember all these things. So practically we need to understand, and this data is basically a core asset that can leverage into that information. So that is why this digital twin model, which can replicate that one physical body into that any electronic file of that particular human health. So that is the something which can be very helpful to understand what exactly that patient health, improving the diagnosis and medication process. Please sir, next slide. So digital health basically it's consists of very small data that we are collecting, whether it is from like wearable device, that is smartwatch is there. You do the home based checkup. You probably having that SpO2 VP machines in your home. So that is also right now it's there. So you can do this small data point which is available right now, can store into certain platform and give us meaningful information. So all this small data we are collecting and give them a meaningful insight out of these things. So that is why this technology can be helpful in a healthcare system for the patient to understand the health and the enterprises also to leverage all the information. Please sir, next slide. So basically, what exactly that is one of the major help it's going to be happen. Just like I said, let's suppose any doctor or any pharmaceutical company, doctor is giving that medicine to the particular group of population. Let's suppose for in a very simple example, we can take some patient those who are having the diabetes, some patient those who are having diabetes plus heart problem, or maybe possible some patient those who are diabetic plus any thyroid issues. They are taking multiple medicines, whether it is an Ayurvedic, homeopathic, Siddha, Unani, anything. So what is basically we need to understand as a doctor perspective, this multiple combination of medicines that is taken by particular patient, and I'm giving my allopathic medicine. So what is the overall impact of this? It's going to be create. What is that recovery rate of the patient? So clinical decision, it means as a doctor or as a person, how can I decide whether this group of population going to be having more impactful drug for this particular? Because there is a multiple drugs are there that needed to be given to particular group of patient, and when this is going to be getting a perfect that more efficacy to this group of population, that data is like not available right now. If I am giving that medicine number one, so what is the impact over the group population? This, what is that medicine number two I'm giving to the group population two? So these data points are missing, where it's lacking to that efficacy of the medication, not understand whether it's going to be utilized by certain group of populations or not. So that is the something, rather than going for the hit and trial model to give the drug to the population, we need to know what is the highest efficacy can achieve if I am giving this particular drug. So that is something can be very helpful. Addition to that, we can consider the diagnosis. Okay, these symptoms are coming, so I need to go for this diagnosis. I need to go for this particular. So decision making process is going to become a very quick. Sir, please next slide. So the clinical workflow, just like I explained, the patient visit to the hospital, and that like we need to be, and someday it's going to be collected. Like I skip one of the point, genetic data. Of course, like India, we need to be work a lot about this one. So once we have this genetic data, And I just wanted to add one more point what Professor Moni has said about this ecosystem data, like that environmental data, which is very much important. So that data also, if I have, so I can know ki my work style, my the area where I used to be work, whether I used to be work in mines area, whether it is in a corporate job, which location, which city I belong. So this environmental factor can also help me to understand whether it is going to be impact my health, how deeply I am impacted with this ecosystem. So it is overall about ki how basically that decision making process can be make very smooth about this data and information things. Please sir, next slide. So the digital twin that I'm giving you that simple example that for that Enigma cloud diagnosis, what the digital twin we have created, we have taken very simple point for the data, whether it is an age, gender, BMI, that pre-existing diseases, whether they have been already any lifestyle disease, vaccination if they have taken, and what kind of when they have taken. So all this small data point that we are taking, and we are comparing these data points with the completely the physiological changes, which environment they are right now, the variation of the health relative studies. So we do this key point studies in our platform. The patient fill certain minor points, and we understand okay, this is the particular thing. So we are right now into the first stage where the data structure, like we are making the data optimization, data structural point. We are taking the certain data points which can be converted as an ML algorithm to identify the future of the health. So this data points, even the doctor has known, we just validated with the Narayana Hospital and MIT also. So these are the data points which can further utilization can be happen for a predictive analytics. And it will basically smooth the journey of this patient and the doctor relation also. And as an individual patient also, I can be much more aware ki which exactly what is the stage of my health, whether I'm likely to get more risky condition, the chances are more high to get any kind of critical complication in the future or not. So this is the way the risk optimization can be understand, whether I need to change my lifestyle, diet, anything. It could be anything where I need to add a more attention. Please, sir, next slide. So this is the some of the ML dataset that we have so far coming up with. The we are taking the deep analytics and the patient deep profile we are making, and this data profile can be utilized by the patient as like I told, it's a predictive analytics, and the doctor also can be understand much more about the group of patient, and just like I said, they can actually understand okay, when my patient is having the high probability of getting in certain condition, and that certain condition needed to be get reduce that risk and that complexity, so the doctor can intervene directly, and our team also basically coordinate with the patient. Sir, you need to take that medication properly. That awareness and education, both the thing is very important in our Indian ecosystem, because they need to understand about this lifestyle disease and health needed to, because Indian approach for the health is very casual. During even the COVID-19, we have seen they are not wearing the mask even a lot of time, but the certain group of the people still do not care. They are, "Chalo, there is nothing to be worried about. Nothing is going to be happen." When the time comes, they take in very serious when they begin to understand. So this intervene to the patient, making that making them educated about this particular health segment is also very important, and where I feel like this particular this healthcare informatics can play a major role, because they directly connect with the mass of the population. The multiple people can connect with the multiple people and make them educated about certain things, what exactly can be having possible situation into the future for your health. So this is something which is very important. Unlike that USA and European countries, the people are very much educated and they understand about the complexity, where the expenditure over the preventive healthcare is very high, and rather than the secondary treatment. In India, we have that secondary treatment expenditure is very high. So this is something can be added very much value. So please, sir, next slide. So digital diagnosis AI model, that the things how this digital twin can be helped to get the patient a particular condition we can predict. Because now, right now, if you're talking about certain AI model has been developed, that first generation that I know, that IBM Watson was there, they have come up with to diagnose the cancer, and the probability of which medication can be very high to suit particular, because cancer is multiple type, cancer, lung cancer, breast cancer is there, the multiple things are there. So which particular things which is going to be having the more impactful, and what is the condition, because this cancer treatment is very complex. So that is where they have approached this data management system. And think about if we can implement for the tuberculosis, for the diabetes, cardiology problem, whether it is for any woman-related health issues, anything, the child health, hypertension, obesity condition. So we need to know okay, what exactly that outcome of this thing. So the diagnosis become very easy here. Even that certain technologies are available where you don't need to go for the hospital, like some of the application-based self-assessment can be done. And the Center for Cancer.gov UK, that they have come up with certain things to this lifestyle disease. Even I think WHO also mentioned their website with this certain symptoms which is appearing in our body during this lifestyle disease progression. Once I'm talking about the diabetes, where some of the common symptoms that we have seen is the urination very frequently, heavy night they cannot sleep, very hunger, very thirsty, and the bones are very less to heal. So some of the symptoms which directly appear into our body that do not even require to visit into the home, like any particular lab to test and all these things. So these are the symptomatic based self-assessment that we are providing in our platform that can help the patient to understand, okay, that is the probable condition can be happen. Now I go to the diagnosis lab to get that confirmation. So we are taking this first approach to do the mass level of screening with our technology that can take almost, and that is the best part, like we can do it anytime at the home that do not require any space or setup or anything. So it can be done. The first level of the screening process is very important. That patient exactly needed to know they are having the problem. Majority of I think the cancer cases has been disturbed or any the cardiology problem once they diagnose into the very later stage. Sir. The problem that I have seen with this particular disease, they cannot able to diagnose into the early stage. If it can diagnose into the very early stage, the probability of the saving that patients are very high. The medication process that we have right now that can be much more effective to them in a very early stage rather than this condition transform into the third or fourth stage. So this is a where that you need to understand this digital twin model where that replicate that particular patient that into that information where I can come to know okay, this is the probable condition can develop, and from today onwards I can start taking medication. So at least this diseases cannot progress into the secondary stage. So that is the best part that we can understand here how basically it can save the life. Please sir, next slide. So this is something that I am just giving you a certain example for the heart physiology analysis that we are doing for the patients. And we ask after certain parameters, the certain very specific things we are going to be asking, whether they have what kind of the pain they have, and then we collect the data, whether you have the diabetic, whether you have the hypertension, blood pressure data, the trend analysis, and after this physiology analysis we do and give them a report. What is that condition it can be appear into the future. So the pain in the chest, the center, and the feeling crushing. So these are the all particular symptoms, and which is something like the pain which is falling from the chest to neck and the hand. And this is a particular symptom which is highly possible condition for getting a patient for any cardiology problem. So this test can transform to the doctor, and the doctor can connect with the patient. Okay, sir, we need to go with the ECG, TMT, or any kind of test which is very much required to understand the cardiology problem. So in the very beginning stage, now they can step into the healthcare facilities, go with the diagnosis, and get the medication as early as possible, and the things can be done very smoothly, and they don't need to go for any critical complications right now. That is the something that we can add it out. Please, sir, next slide. So, like we know that there is a particular disease, and it can like what kind of a medication I need to give, what kind of a particular diagnosis we need to give. So this is the something. Let's suppose I have treated the thousands of patients, which is impacted with the cardiology and the diabetes. Now I know okay, that my experience itself I know this particular drug can be impact a lot to this particular group of patients. If I have given this particular drug to this particular age and gender population, the impact it will be high and low. But after certain times, once this doctor no longer going to be remain into the practice and he moved to certain places, now what is going to be happen with this data and information and the knowledge that as a doctor I am carrying right now? So the best part, if you have replicated this system into one technology, it can be utilized by other doctors also. From the rural population, this secondary level of the doctor, those who are just coming out of the college, they can take this adaptation and that efficacy of the treatment and medication process can become very high. It's a kind of something you can take that reference of 10 years of the data from that experience of certain doctors and the patient data can be give this meaningful information for what is the kind of approach I need to take to treat particular group of patients if they are coming like this thing. So just like I told, the hit and trial model can be eliminated or very high. The efficacy and efficiency can be achieved in a very accurate manner rather than going with the hit and trial model. So that is something it's going to be add a much more value. Please the next slide. So assisting and evaluating the right therapy. What exactly is happening in India system that we know, particularly I'm talking about because there's a lot of diseases that we know that a particular drug is going to be work or not. That is very complex. Even the doctors sometimes they are into very confused state whether this particular drug is going to be work for particular disease or not. They just give and they see whether the response is good, then they continue again. Otherwise, they will replace. But if we can replace this system, giving them particular drug one, then drug two, then drug three, this things is coming with the most of the cases, and especially I see in a cancer kind of cases where and diabetic also and other diseases they need to keep on replacing and changing the multiple drug. If this drug can be very patient specific and disease specific, this combination of these two things can increase that saving the life of very high. And that patient do not need to be worried about their treatment. They don't need to go with this painful process of multiple treatment process. Exactly, that is the something which is very much important. And it is going to be not just cost the money, it is costing their life because the time delay is happening by finding that correct treatment. And there is something that we can see someday they will be running out of the fund, maybe possible they have a very limited fund. So what they will do if they have a very limited fund to get the treatment done. So this is something when we have this disease specific and the patient specific drug modeling, when once I know that this particular group of patient can be very useful for this particular drug, can save their savings as a patient, that they can save their money, and also they can get the treatment in a much more effective way. The treatment can be much more effective way, can lead to them uh, remain them healthy for a longer period of time. There will be no side effect actually after that treatment. That is the something is very important. Please, the next slide. So, just precise medication, that continuation part I wanted to give, like just like you know that some of the cancer treatment, once the drug is given, the chemotherapy or radiation therapy, they coming up with certain other complications. The one of the problem with this particular treatment process is happening right now. It's okay that I'm giving certain medication, and then after that secondary complication is coming. That is where the doctor is struggling more. Okay, this particular patient, if I'm giving this particular set of treatment, then after that the secondary complication is going to become as a side effect. What is the side effect is going to become? Like we have seen the cancer treatment make the body very loose, and the loss of hair and the body weight is also completely gone. This is something which is coming out of the after the chemotherapy and certain medication thing. What if we can, like this particular data set, once we have large amount of the data, we can understand and we can certain the pharmaceutical companies can come up with certain molecule which can be not impact to the other body organs. It can only damage to the cancer cell itself. It is a very disease specific, so it will be the target area. Let's suppose the cancer is in the lung, so it can be only administered to the lung area, not to the whole body. It not needed to be give that IV and completely whole body. It will going to be damage the lungs, kidney, heart. So the disease is specific, organ is specific. That drug is right now. I think nanotechnology is something which is working on this particular segment, that target area. So very precise area they will hit that molecules to treat and kill that particular thing. So this is something which can be overall can be taken out of this data and information system. So data-driven model definitely going to be help to achieve that high level of precision of medication. That is right now it is very much important, especially that after the COVID-19, since we know the cases of type 1, type 2 diabetes are going to be get very much increased, and we don't know exactly the problem, the medication which is right now, which is uh, working for the population before the COVID and after this COVID, whether it's going to be remain the same efficacy or not. So that R&D and the research needed to be continuous process. It's not like that I have given that medication like azithromycin to one certain population today, it can be work for the tomorrow also. We have seen in the child we used to take 250 mg of antibiotic. Now we need to take 500 mg, and some people are also beyond 750. So the drug efficacy keep on getting changes. So this is something where it can add a value. Please, sir, next slide. So this is something that sir has been very specifically talk about overall health we are talking about. This is the unified healthcare system that we are talking about, where the human health needed to be taken considered with this livestock picks, animal health also, the plant health also. This will give that overall healthcare information, and it will give that overall geographical area as a wholesome. We can understand okay, what is that overall health care as a means. Like it's not just a human health we are talking about. We need to remain healthy. That ecosystem also needed to remain healthy, and this is where I feel like this healthcare informatics is going to be help a lot to create this unified healthcare ecosystem, where that every single set of label like ecosystem one to bottom line, everything can be taken care here, sir. The plant health also is very important because directly we are consuming a lot of things from the environment, and this environment is needed to be healthy. So every parameter, like I just told about distal twin for the human health, the same thing can be implemented for that environmental, for the plant diseases, and soil health is also there for the good cultivations. Water monitoring, air monitoring is there. So this thing overall going to be, we can actually develop a certain correlation to develop these things, whether this much of things is happening to the plant health or anything, or how much impact it can create to the human health. So direct correlation we can build it up. There's a lot of data set can be created after once we have this unified healthcare model, and it can actually going to be add a impactful thing to create a good health ecosystem in our country. So that is very much important. So please, sir, next slide. So this is something that we come up with the map. It is an Enigma Cloud health map that we say. It's basically that we are mapping, sir, what exactly we are trying to do. There's a different kind of platform we have given to, let's suppose, certain location to map their population health. Some population, how much kind of diseases they are getting. Schools we are doing digital health campaign in the colleges, so we can map their health, and we can understand this particular location how much population they are getting malaria, typhoid, how much population out of them they are having a bp, sugar. So these things completely going to be get the data, and we know this particular location is having this kind of system. This health map is going to be overall going to give you that uh, broader picture ki what is the demand supply gap can be created in the future, what is the most responsible thing which is causing this particular disease. Let's suppose some places which is having a lot of asthmatic chronic COPD problem, it means there needed to be worked out certain environmental air pollution needed to be very high. Some places where the waterborne diseases are there, so we need to look after this the water quality system, air quality system. So the environmental health also can be assessed with this mass level of data and information, not just in a personal level. It can be created in overall environmental system, how we can actually understand this particular environmental system is getting the problems or not. So overall health estimation can be done it out with this thing. So please, next slide. I think it is like end of the slide, sir. So that is overall from my side. Actually, I just wanted to.
So it is very important. It is. It's a God's gift that today we are able to run this program with all the difficulties. It is
Yes, sir.
Mr. Sunil Kumar. It is a very important address you had it, and health system is very important. So now the time has come that people now talk about One Health. As a man who are involved in informatics development programs from bottom up process, Even in 1987, I put a district information system on health, Disney Health. That was a project which initiated. If all the 28 components, if the government would have adopted, today we would have got a better data, raw data. And that time, when we talked about district information system, there was not much technology. There were not much technology. AI was not there. It's being under various research, platform. Today, technology is available, and but we were able to visualize that information system is very important, and so I am very happy that this is, we worked on it. And then 95, when we started IT blueprint for agriculture, we know that by the time I was able to might have traveled more than 400 districts under the district program. And I realized that, rural, there is some sort of a distress in the rural area. So intensification of digital technology is a must to bring rural youth to get onto the platform. So they should not do migration to urban area. So
Exactly.
that's how that, 15 informatics network program were launched. When I was initiating, people told that what, this gentleman is an executive technocrat, would like to do that. But with the help of Minister of Agriculture, we were able to launch that program, and rest is the history. And then by 2010, I was able to operate 2010 to 2012. I was able to network 7,032 locations. I was the Deputy Director General in National Informatics Center, working with the Minister of Agriculture and the Department of Animal Husbandry, Dairying and Fisheries were able to network 7,032 locations to monitor animal disease in the country, first in the world. And that gave a lot of understanding. And I was also asked to deliver a talk in the National Agriculture Science Congress, which was held in 2011 in Lucknow. This is where I talked about how to reduce farmers' loss. And then in doubling farmers' income, this has become a part of the recommendation. Then during the COVID situation, I decided that I should conduct webinars to propagate as to how to go for operationalization of doubling farmers' income committee reports. So when one technocrat, a senior technocrat, a retired technocrat, with the help of engineering university, who has taken agriculture as a use case, established centers of excellence to promote technology, then I thought that it is very important to have health informatics discipline, because one is digital health is evolving, but it has to be utilized. There has to be a return on investment, very effectively. Technologies are emerging, so we need to have a lot of human resources in this area. So that's why we thought that let us have an out of box thinking. So and COVID situation came, which has given a lot of lessons to us. Today your talk also talked about many things in this area. But Mr. Sunil Kumar, I appreciate your work, and that's why the country also has given a lot of awards. Your interest and your research work, and you are also able to publish 3 research articles in the international journal. And I see that with the approach of the Shobhit Institute of Engineering Technology, with these centers of excellence, how we would like to work together to bring this one in a larger scale. I said it in my talk that the country needs about 2.25 lakh health tech startups in the country. If digital twin has it, it is possible, because BharatNet, a high speed internet based network, is being made available to the village level. The network is called BharatNet and is becoming a Bharat Mala. And
Exactly.
why can't we utilize these one universities like Shobhit Institute of Engineering Technology and startups like you, who did high tech research and academic, in biotechnology, in MTech nanotechnology, and doing PhD in this area. And your startup has, won a lot of accolades and also well recognized. And we should join together to launch MSc in Health Informatics program. And let us generate human resources to understand digital twin in agriculture, in health informatics.
Definitely.
They will be the highly preferred people, much better than computer people, coders. And data analytics is very important in health area. And this will also facilitate open insurance ecosystem. Health insurance is another very big component. So digital twin in health and open insurance eco health is available. It's fantastic. And let us also try to do that innovation ecosystem, digital transformation, and innovation management systems standards. And if we are able to apply in this area, I think this may be the first, you know, university and the startup to work in this in the world, working in the health informatics network value chain. No other universities in India is talking about health informatics network value chain. Forget about even all medical colleges, not even AIMS. And
Definitely.
every
So
system is, every health component is vertical, and within the human health component, Ayus and allopathy is vertical. And now government is trying to bring in synergization, but it will take time. But we can't wait. That regulators will have their own interest to delay it. But common
definitely.
public, why should they suffer? Why
So
can't have the technology? You can't have umpteen number of COVID situation to make the regulators to understand. So I thank Mr. Sunil Kumar for your wonderful address. And
thank you so much, sir.
you talked lot of things, and I summarized in such a manner that we have to take a pilot projects in every state, one pilot project.
Definitely.
And I will request you to sign an MOU. I will send it to you, and with the two aims, two objective. One is to start MSc in health informatics, BSc in health informatics, and then your lab will become an internship lab. We also have a strong department of biomedical engineering. We do a lot of research in based on Rudraksha. And
Okay.
we have Ayush Medical College, and we have Ayush Medical College, and also biomedical engineering, and also have a center for health informatics and computing, and also that center for informatics development solutions and application, industry 4.0 technology studies and application, and agricultural informatics and e-government research studies. What else is necessary? This is a real ecosystem to work on technology needed for rural India to shine, smile, and roar. So
Definitely.
with this, I would like to thank you. And before I close the webinar, I would like to hear from you, what should be our action plan? Over
Sir,
to you.
exactly whatever the things that you have told, sir, it's very true. We don't need to wait. First of all, like that is the strong feeling that even I believe ki once we get any idea, we need to execute. That is the first thing. That is an entrepreneurial mindset that we have. We just don't need to wait for certain things needed to be get right. We need to make it right actually. So it can be done only through that execution, and I think like institution like yours can be play a very important role. And as far as I see that there is a lot of scopes are there, because right now even the government has taken certain initiative, but we have taken even a much more bigger step to understand and leverage this data and information. We have our technology also. I think once it will, and we've been so far. I just forgot to mention we have certain private-based venture capital, because that they invest into the startup that So the certain things in a series round of investment we are about to close after certain things. So definitely, if we are going to be associate, I think we can work with some of the bigger player out of that, where we needed this infrastructure setup, or we definitely required the certain trained manpower that we can generate through this MSc Informatics. And the further thing, expansion is going to be there. There's a lot of cash intensive processes there, so definitely that part we can arrange from our side also, through certain we will going to be pitched to certain VCs and other thing. So I can, it is possible for us to make it out, and I will definitely going to talk with one of my team also. We will proceed this thing. And after certain milestone, one is going to be taken care, so that will be a win-win situation for you and our organization as well. We can take this
Yeah,
thing with a certain other approach, because that other people, they have a bigger network also, we can leverage their network as well.
it's very nice that, I was quite impressed by one of the slides you said digital twine in health, human health, in plant health and animal health and soil health, water health and environmental health. That's why, one is that doubling farmers' income by 2022 committee set up by Honorable Prime Minister has recommended an integrated digital health management system, combination
Exactly.
of human health, plant health, animal health, soil health, water health, and environment health for the reduction of farmers' loss. They themselves
Exactly.
constitute, rural India and 14.5 crore operational holders, and each farm has got about 4 people population. You can see that about population in the rural area. So we have to build up. See, today medical systems are being built up in for urban areas and smart cities. Nobody bothers about smart village.
Exactly.
Nobody bother about smart village with smart health and smart agriculture, smart farming. So this is a time that we have to bring in smart village with smart health and bring in digital twin in all areas. And technology today provides, and this is very important. And I have, from the university, we have 5 centers of excellence, and then schools of teaching, biomedical engineering, bioinformatics, and then Ayush Medical College. And with this one, we can have a complete comprehensive ecosystem to bring in digital twin in health informatics. We can bring it out. So this is a big opportunity which I visualize. That's why in the webinar series, 10 webinars were on this topic. And since I worked in technology, worked in e-governance, worked in informatics research, and after my retirement I didn't go to industry to work. I thought that a man who was born and brought up in rural area, I should bring in technology based development for rural India. That's why I joined the university, and I'm thankful to the honorable chancellor who invited me to participate in the program in the university as a professor emeritus, to work in the area of informatics research, and especially in the agricultural informatics and related area. 5 centers of excellence and health informatics network value chain, and 2 universities working in the area of biomedical engineering, and also that Ayush medical education research, and startups like yours working in digital health analytics leading to digital twine for better health care, doing research work in a very important area, a man of nanotechnology understanding, doing research. So let us join together and let us undertake pilot project in one district per state.
Definitely.
And university and you can put up proposals to the funding agency, and we'll
Definitely.
have a digital health tech startups to bring in digital twin. Let us work with various both private platform as well as public platform,
Sure, sure.
and this
It will
is
be like more
my
like
action plan.
public-private partnership.
And and that is very important. And today we have 50,000 primary health centers. A doctor joins after his MBBS, and afterwards there is no training for him. And there are
Definitely.
about 42,000 animal husbandry primary health center. Veterinary doctors don't get trained. So if a clinical AI is put it in the primary health center and animal health center, and if this with the digital health analytics with respect to each animal, each human being, and each plant, each water bodies, and each farm health, and we can do wonders. And data analytics, our nobody in India can be jobless, and
Yes, sir.
they need not go for a clerical job in the government. They have to have a biology understanding, and biology and health informatics we can generate lot of employment opportunities.
Employment
With this,
opportunities.
I would like to thank you and your team, and also I would like to thank Honorable Chancellor, Vice Chancellor, His Excellency Secretary General, African Asian Rural Development Organization, and also the participants, and above all, Mr. Manish Chabra, who is the man behind the show. With this, I would like to, close the webinar and leave the studio. Thank you very much. Thank you.
Thank you. Thank you, Vinod, sir.
Thank you.
Thank you so much.
Thank you.
Please
Thank you.
continue.
Thank you. Thank you.